welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. And well, viewers, your body's musculoskeletal system is a complex system of bones, joints, ligaments, tendons, muscles and nerves, and allows you to move, work and be active. If any day you find any difference in your body movement or you see some pain, then you must have a proper orthopedic diagnosis. So today we have taken the topic called joint replacement, and to discuss more on this topic, today I am joined by Dr. Rakesh Das, who is a consultant orthopedic from Hayat Hospital. So not to waste any more time, I'll straight away move to doctor and talk more on the topic joint replacement. Hello doctor, welcome to Good Life, the health show. So you're here and you will be guiding us to the entire show about joint replacement, the topic which we have taken. So first of all, I will like to ask you, doctor, what is joint replacement for the benefit of our viewers?
Yes.
Okay.
Joint replacement, basically the people who thinks that joint replacement means changing the joint as a whole is a misnomer.
Okay.
So basically joint replacement it's done in osteoarthritis. It might involve the knee joint or hip joint or any other joints. It can involve shoulder, it can involve elbow also, but most commonly the involved joint is the knee joint.
Okay.
So what happens in osteoarthritis? There is destruction of the cartilage. Joint has got the two surface which is moving and the cartilage makes the movement. Okay, so the cartilage damages. So in joint replacement, we remove the diseased cartilage.
Okay, you remove the diseased
cartilage,
okay.
And in place of that, we put some metal prosthesis along with some polyethylene, so that it can glide as a normal joint. So that is joint replacement.
That is joint replacement.
To remove the diseased cartilage and replacing it by some prosthesis.
So this was a confusion among many of the patients out there. So when one patient comes to know that they have to go for a joint replacement, or if suppose they are having a knee pain since quite a long time, so will this need a joint replacement, or this is just a notion which everyone has in their mind?
No, all patient doesn't need joint replacement.
Okay.
Actually, it's the last mode of treatment in any replacement. This is the last treatment, sort of treatment. So the patient usually complains of pain in the knee. They will have pain and swelling, and most commonly the patient involved is the more than 50 years old. So usually the females are commonly involved, but males are also involved. Now the age is coming down because of the lifestyle, increased body weight, lack of exercise. So as the body weight increases, it gives more force per unit area in the joint. So the body tries to take it away by giving rise to osteophytes. So osteophytes is increase in the extra bones. So the bone enlarges. So as the bone enlarges, so there will be pain, because God has not given us the extra bones. The extra bones is due to some disease process. That means, for example, most commonly is the weight. So that extra bones pinches on the cartilage, on the ligaments, on the surrounding tissues. So that causes pain, and initially all the patient doesn't grow extra cartilage, extra bones. So first of all, you have to consult your orthopedic surgeon. They will do an X-ray. In the X-ray, we can classify it in 4 stages. In the initial stages of 1 and 2, patient can improve with some medication, exercises, physiotherapy. And but in stage 3, the patient needs to go for some viscous supplementation, which we say is gel in the joint. We have got jelly-like substances in the joint, which we call it as viscous substance. So he might need to replace those gels. But in the stage 4, definitely yes, we need to go for joint replacement.
So you were talking about that gel. Sometimes what happens, the gel gets dried up. In that case, what you have to do, you have to go to a proper diagnosis, isn't it? So in that case, what a patient needs to do it? Because for that, the person feels difficult to walk on stairs and difficult to walk properly, and they find it difficult in walking everywhere. So in that case, what the person has to do?
Yes, if the gel dries out as the joint patient is elderly group, and the patient has more pain, so the jelly usually dries up gradually, and he will have persistent pain. In that case, we need to do an X-ray and find out. We have to balance it. That means if the osteophytes, that means extra growth of bone is more, then the patient will not improve with the jelly infusion. If the extra bone growth is less and the jelly is dry, so joint is dry, then if you infuse jelly, that means what we say in medical term viscous supplementation, then the patient improves.
Okay, so basically one should not ignore, and basically one should have a proper diagnosis. Because if they find any pain in their knee, which is fine maybe for some kind of concern, so they should not avoid those pain kind of thing, and they should always go to see orthopedic, and they should have a proper treatment, isn't it, doctor?
Definitely.
So doctor, what are the common causes one can make out that they are having, they will be like prone to have a knee replacement or a joint replacement? First of all, what is a knee replacement and joint? It's the same term.
Same thing. Arthroplasty and replacement surgery are same term.
So what are the causes, doctor? We would like to know.
Causes of replacement.
Yeah, replacement or causes of, like, suppose the person wants to have a joint replacement, or suppose he or she will have to go through a joint replacement. So what kind of causes will make that person know that he has to go to a proper diagnosis?
The most common indication of joint replacement is pain.
Is the pain?
Pain. Persistent pain.
Any kind of pain?
Any kind of pain, especially joint pain.
Joint pain.
So, if the patient complains of persistent pain and he cannot do his daily activities, he cannot walk, he cannot walk for half an hour, he cannot go to any ceremony. So, those are the candidates who requires joint replacement. Yes, it's also done, joint replacement is also done sometimes in deformity. Sometimes you will see that around more than 50 years lady who is fatty and her both the knees are bent. Gradually, because there is cartilage destruction and your knees gradually bends, either inside or outside. Most of the times it bends inside, sometimes it bends outside. So those are the indication that your joints is gradually degrading and you need to consult an orthopedic surgeon. And if on x-rays, your x-rays show it's a grade 3 or 4 osteoarthritis, your doctor will advise you properly whether you require a knee replacement or not. But yes, if you are symptomatic, you have severe pain, stiffness, not able to walk, you are bedridden, then yes, you are a good candidate for joint
And initially, if we come to make out that, then we don't need to have a joint replacement, isn't it?
No.
If initially we can do it from the proper medication as well. So what kind of proper medication do you suggest to the patients who comes to you and you see just signs are of the step 1 or the step 2?
Most important thing is weight reduction. So now
weight reduction is very important.
Very important. If you come to the causes of knee pain, so there are many causes. So let us find one out of 100. So first cause is osteoarthritis. Osteoarthritis occurs usually in elder age group because with age bone changes. So that is first cause. Second cause may be other diseases. For example, rheumatoid arthritis. Rheumatoid arthritis is an inflammatory joint disease which can involve any joint. So it can involve wrist, it can involve ankle, knee, hip, any joint.
Any of the joints.
Any of the joints. We have many patients of rheumatoid arthritis. Those are the second category of patient. Third can be due to trauma. That means post trauma. You have a fracture in, for example, 10-15 years back, and your limb is a bit deformed. So your biomechanics changes. So that can lead to cartilage degradation in the joint. So later on in your life, yes, you might. That is another cause. Fourth cause can be due to medications. For example, people can take steroids in a lot of other diseases, autonomic diseases, people take steroids for a long time. Those diseases also creates many problems in the joint.
So these are the basic things, and one should also have to take control of their weight. So weight is a very proper factor. One should have to have a maintenance of their weight. The proper management of weight is very important. So for that, what would you suggest to the people out there to how to maintain their weight? Of course, they have to have a proper diet. So in that case, suppose if someone is having a joint pain for quite a long time, so what suggestions would you give to them?
Yes. See, doing exercise in an elderly patient who is having osteoarthritis knee, he will be having pain in the knee joint, and you are telling him to do exercise. How can he run and how can what can he do? So he cannot do.
It's not possible.
Not possible. So there are two types of exercise. One is isometric and isotonic exercises. Those non-weight bearing exercises where you doesn't require weight bearing. For example, cycling. You don't need to run. You don't need to give weight on your knees. So you can do proper cycling exercises. Those are good. Then you can do swimming. Swimming is a good exercise. You can do that. Or you can jog. You can no need to run. Running is nowadays it's seen running doesn't help much. But if you jog, if you walk for a long time, 30 minutes to 45 minutes, it's quite sufficient.
Okay, okay. And cycling is the best part, as you mentioned just now. People, we have seen nowadays many young boys and girls, they come out and cycling. So they have taken up cycling as their health benefits. And we have also, they hit the gym and they are very conscious about their health. So for that also, sometimes what happens, the ligaments also break down and they also have a joint pain or any of the joint pains. So for that, what would you suggest to those young boys and girls that they are hitting the gyms for their health benefits, but in that case you have to take proper care of your health as well?
Definitely.
So for that, what would you suggest to them? So suppose if they are hitting the gym and they are using quite a good weight to build up their muscles or whatever they want to do within the gym. So for that, they have to have a balanced weight to be picked up. So in that case, what would you tell them to have a balanced weight to picked up in the gym and how to take care of them whenever they are hitting the gym? What would you tell them?
Okay, see, to reduce your weight, basically only doing exercises will not help you out. You need to balance everything. Your diets and yes, proper exercise. Okay, in the diet, you should reduce your fat content, also carbohydrate. Previously, we thought that taking chapati instead of rice will help us to reduce the weight, but it's not like that. We should reduce all sources of carbohydrates. We can take, we should take protein and fats to some extent, and you should take fruits as much as possible. Okay, and you should do proper for the knees. You should take proper quadricep exercises. Those you can see in the net also, or you can come to, you can contact any orthopedic surgeon or physiotherapist. They can teach you the quadricep exercises, which is best for the knee joint.
Okay, okay. So one of the patient, whenever they come to you and you have done the joint replacement for that patient, so how long does the joint replacement go on? So is there a time limit or something like that?
Yes. This joint replacement is nowadays is not a new surgery.
Okay.
It came in the year around 1970s. So now it's 2018. So it's almost 48 years down the line, and we have got a lot of study and researches regarding this joint replacement. So a nicely done joint replacement usually lasts 25 to 30 years.
Okay. Quite a long time.
Quite a long time, yes.
Okay. And what about like the technologies are upgrading and nowadays many technologies have come up. So it has become easy as well. So whenever a patient comes to you, the patient might have so many questions in their minds that they are going to have a joint replacement. So they might be very scared also. So in that case, so how do you study their psychological part and you tell them that you don't have to worry because it's very safe because technology is upgraded. In that case, what kind of consultation do you give to those patients?
Yes, people when they think of joint replacement, especially of our region, they think it to be a very big surgery, joint replacement.
Right.
Most of the patients think, okay, it's a very new surgery, it's a very big surgery, it cannot be done here, and we should go out of state.
Everyone
to have the
has
surgery.
that notion actually.
Yes, that notion actually. But now I can say you we are doing a good number of replacement surgeries and the results are also good. Yes, all the surgeries has got some difficulties, okay,
complications,
yes. So we have to take care of those complications. For example, in joint replacement, infection is one of the common thing, but if your OTs and if your protocol are good, then you can reduce the number of infection to minimum.
Okay.
And you have to go for proper physiotherapy after the replacement, and there are some protocols that we should not squat. Yes, you should not sit down much.
Okay.
Otherwise, main indication, you have to go for an indication. What is the main indication of the patient? She will complain of pain. You need to relieve her of pain. That is our indication. Make her mobile. Initially, previously, all those patients, people used to say you don't have anything to do, so you be bedridden. But it's not like that now. We can make any patient mobile after doing knee replacement.
Right, right. And when a person goes through knee replacement, so they have to be very cautious and they have to take extra care. As you were mentioning, you don't have to sit in this way. So what are the things, what are the key points they have to take care, best care, and their parents, and of course the family members also have to take care because this person has gone through a knee replacement. So how we have to give their extra care to that person?
See, the protocol after knee replacement is that immediately after the surgery, we make the patient walk in the next day itself. Okay, because there is a complication called thromboembolism. So to avoid that complication, if we make the patient mobile as soon as possible, the complication chances reduces.
Okay.
So it's our protocol. We make the patient mobile as soon as possible. And in
that's the main first.
That's the first thing.
And
Yes, yes. And the patient also gets confidence. Yes, I can walk.
Yeah.
And she will, when she will walk, she will not get any pain. So within 2 to 3 days, when the patient is in the hospital, she gets confidence, and the patient leave the hospital walking.
That's what, the willpower and the confidence,
Yes,
which comes from the doctors as well, and they give us that confidence, and in that case also they heal their pain very soon, isn't it? Medicines are there to heal our pain, but our willpower and also our confidence also heal the pain as well. So, doctor, severe knee pains, these are the hot topics, and these are the major topics which everyone speaks about, and especially the elderly persons who are at our place. And we also hear knee pains from among the young people as well these days. So, what is the cause, and what are the reasons behind those knee pains?
Yes, most of the time you will hear the knee pain in athletes, sports person, because they use their knee a lot.
Use their knee a lot.
Most of the time there is a cartilage degeneration. Okay, so cartilage degeneration is a big topic now. It's coming up. And in that cases, we can give glucosamine. There are medicines which helps in the cartilage regeneration. Sometimes there is ligament injury, sports injury. Okay, if someone falls, ligament injury, so we need to reconstruct the ligament by doing arthroscopy.
Okay.
Sometimes, yes, with some physiotherapy and exercises, it gets well.
Okay. So those glucosamine supplements or whatever pills you are talking about, is it a pill? So if they are taking up, is there any side effects for that?
No, no. That is a supplement, food supplement. That's not a medicine
okay.
Such.
That's a supplement.
It's a supplement, yes.
So one can use it and one can have it properly at any time. So there is a timing of having those supplements?
Yes. Usually you should take glucosamine around 1500 milligram.
Okay.
1500 milligram. So it can come in a single tablet or it can come in split. For example, 750 milligram if it is, you have to take twice daily, and if it is single tablet contains 1500 milligram, then you can take one tablet also.
Okay. So doctor, if we talk about your experience, you have gone through so many kinds of patients. So any kind of patient who was very tough for you to handle and you had a good time and you had a proper like investigation about their problem and it went well and the experiment came well and the person was very happy after the replacement which you have done. So any kind of incident you remember and you would like to share it with us and to our viewers?
Yes. I had a patient from actually Upper Assam.
Okay.
She was around 90 kilograms weight.
Okay.
She was height was also around 5 feet. And she was very fatty. Okay. And she had a deformed knee.
Deformed knee.
Deformed knee. That means her knee was inside. Okay. Varus deformity. We say varus plus flexion deformity. So she had both the knees problem, and she had shown many places. And then she came to me in our hospital, Hayat Hospital. So I told ki I have done an X-ray and I find out ki she had osteoarthritis stage 4, and there are a lot of new bone formations. Okay. Extra bone formation. So she was not able to walk. 2 people has to bring her inside. She was around 72 years old. So I told her, I explained her everything about the surgery, knee replacement. Yes, you have deformed knee. We need to go for the surgery of both the knee joint, because as the knee is deformed, you correct one, so other one will remain deformed.
Okay,
so
okay.
she will
So
not be able to walk. You need to correct both the knees. So I told her ki I will correct one after another. So till now I have corrected one, and after 2 months I will be doing the other one.
Okay, so still it's in the process.
Yes, yes. Initially the patient was very reluctant. She is told ki yes, I have gone many places, many people advise this, but I was not confident. Then somehow she had confidence in me, and I have done the surgery. It was very difficult, but it went on good.
Okay.
And the patient is happy, and she wants to do it the second one as soon as possible.
Okay, so she gained that confidence actually.
Now she is saying ki the operated side is so good, and I don't want to keep the unoperated side. I want to do it as soon as possible.
Yeah. Okay, so that's a very good sign, and when you hear these kind of cases to be successful, you also feel yourself very happy, isn't it, doctor?
Definitely.
So doctor, on last note, like it's very time now to wrap up the show, but on last note, what you would like to suggest to the viewers out there, how to take care of themselves and how to have a proper diet and how to maintain their weight to not to have any kind of knee problems, isn't it? So what would you like to suggest them?
Yes. Young people or older people, everyone should do proper exercises. Yoga is a good exercise. Okay, normal what we are doing in the gym is also good. Yes, and you should not increase your weight. You should maintain your weight so that your knees doesn't get extra weight.
Okay.
And if you are having stage 4 osteoarthritis, severe pain in the knee, go for a joint replacement, you will have a pain-free life.
Okay, so thank you so much, Doctor. It was like pleasure having you in our show, and you gave us such valuable inputs on knee replacement. And one had a notion about knee replacement that it is very important and it's very dangerous. But as you mentioned, it's like it's so smooth, and nowadays technology has so upgraded, so one should not have to get feared, isn't it?
Yes.
So thank you so much, Doctor, for coming to our show and giving us such valuable inputs. So that was Dr. Rakesh Das from Hayat Hospital, and he was here and he was talking about the knee replacement and knee and joint replacement side by is the same topic, and we already had a discussion about everything, the causes and what one should not avoid, and one should have a proper weight management. One should have a proper weight management because joint replacement surgery removes damaged or diseased items in your knee, and a parts of joint which is like to be replaced is doctors are there to have a proper diagnosis, and you might have any kind of pain. Just go and see an orthopedic and you will have a proper and a pain-free life. So on that note, we'll take a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja. Alright, so well, it's time now to move on to subject which plays a very crucial role in our lives. In order for our bodies to function properly and stay healthy, it is important that we follow a good nutritious diet. And well, to discuss proper food habit for a school-going children, we have with us our nutrition expert Tina Baby Borwa, who will enlighten us on how proper diet in our daily life is of great significance. So Tina, welcome to Good Life, the health show once again, and you will be guiding to the parents out there to have a proper diet for their school-going children and what kind of diet they should carry and they should have them for their children to carry in their tiffin. So first of all, you are here. So what first basic thing you will tell the parents of the school-going children?
School-going children are they are in a very crucial stage,
right,
because that is a stepping stone for them for a entire life. They have to build up their nutritional habits, good nutritional habits, and how they will be carrying forward in their later future of their life.
Very well.
So the major nutrients that are important in school-going children are like energy, then protein, and most importantly, everybody are more concerned about the vitamin. Like people always, when come to us, you give something which is gives them vitamins all the way.
So they come to you and they first of all they ask for vitamins. Okay.
Yeah, that is right. But they forget that there are some medicine. I mean to say, there are some foods which plays a medicinal role. Like iron and zinc are also equally important for the school-going children, because these are the two nutrients which helps them to build their immunity system.
Right.
Because you have seen some children, they quickly fall sick, and some are they can resist the any type of seasonal changes or any type of like flu or in
all the
like,
seasonal
diseases, those they can resist, because maybe in their body that immune system are more strong rather than the other children. To boost up their immune system, iron and zinc plays a very important role.
Okay.
So school-going children should take food items which includes iron and zinc, like pumpkin contain zinc, and irons are mostly available in two types of irons are there. I'll tell in a gist, like heme and non-heme iron. Plant iron, from the plant, like green leafy vegetables, you get iron from there, and also from like legumes and pulses, maybe from this one nuts, or from the that moong or chickpeas, then
which are easily available.
And desi chana, kala chana, that is, if you sprout it, it also becomes rich in vitamin C.
Right.
Vitamin C also boosts up the immune system, whereas some non-heme irons are like presence in the animal food products, like maybe chicken or egg, full egg. The children has to take at least 2 number of egg a day. Okay. But
so if a children is going to school, so these are like basic things they should carry in their tiffin.
Yeah.
So what are those basic things one should carry in their tiffin?
And also I'll add up that calcium is also a very important thing. Okay, in school going children, because their bones has to become stronger because of
they
that.
have to go a lot of physical activities in school.
Right, and you have seen some of the you know, advertisement to become your bones more stronger, so you drink this and that. But people forget that some of the homemade things also that are available in every household can build up the bones very well. Like they can have regular at least two times a day a milk or curd, whatever in the form they wish to have, or in as it is now a little bit of, you know, hot weather, they can make some smoothies at home. But one thing is that we have to always be concerned the fat part in the milk. So it is better to go for a skim milk rather than full fat of milk, because that one will again, if school going children keep taking too much of full fat milk, it will lead to again obesity. That also have to be checked on. Yeah, right.
So one suppose and one proper breakfast is very important for a school going children, because breakfast plays a very important role in their life, because they have to go to the school, they have to have their assembly, and we have also seen quite a few number of children, they faint down when the assembly goes on, because it's summer season and sometimes summer happens and it's a very scorching heat outside, but you have to do their assembly. So a proper breakfast is very important. So what would a parent need to do to have a proper breakfast to be made for the children?
Parents should always be concerned, they take the dinner and the gap between the dinner and breakfast are quite long. So if the child do not take proper breakfast, the memory span is also become low. They cannot concentrate properly at the school. You know, that time, that is why, like, this is very, very important. They have to put more concentration in the breakfast what they take. Like some of the children I come to know that they skip out the breakfast and rush for their school. But it is the role of a parents to guide them properly, that proper breakfast is very important, a balanced breakfast. That should include at cereal part, like maybe roti or maybe some of the broken wheats and all, like cornflakes, maybe oats, dalia, or some are very used of taking rice also. That is also fine, because that will give them energy. But along with them, they have to incorporate some protein part, maybe a glass of milk, maybe a ball of dal, or maybe a ball of chickpeas or rajma, anything that gives a protein source. And along with that, they have to take some fiber also. So the fiber they will get from the veggies or cut fruits. So that also has to be a complete breakfast.
Balanced breakfast. And to do all this, we have to have a proper time management as well, because if we are in a hurry and the children, and if the bus is waiting and the children goes that mama bus is here and I have to do, I won't eat more. So in that case of time, that you have to have a proper time management so that the children eats properly and it can have a healthy life, and throughout the day the child can have a proper life and they can have a regular physical activities in school as well. Okay, so what more you want to suggest, Tina?
I would also like to tell that school going children's, as I have mentioned, that is a stepping stone, this age group, like 6 to 12 years, you can tell. After that, they will become adult. So the parents has to inculcate some good habits, food habits, in terms of like what is healthy foods. So they have to be taught at home. Proper parenting, it is very important.
Very important.
At least they should have meal together. When they will look their adults of having all sort of food, then they will also be able to have, like, the homemade food things, and they will not be more of like fuzzy kind of things. No, I won't take this and that. And they will be like, if the adults play a role model that these green leafy vegetables are very important for you because of your eyesight, it gives you calcium, it gives you iron. They have to have little bit of knowledge regarding the food items, whatever they are providing to their children, and that has to be delivered to them also.
A basic knowledge should be given to every children, so that they can also come up to their parents and they can also, like, they should not give a no whenever parents tell them to go for this food and not to go for this food, isn't it?
Yeah, I would also like to tell that I have seen many parents, they snack a lot to their children.
Yeah.
Snacking is not allowed before the before major meals like breakfast, lunch and dinner.
Okay.
If you give lots of like high fat snacky foods to your children before these 3 major meals, then they will skip out the they will not feel hungry and they will not eat the proper lunch or dinner. When they will skip out the major meals, there will be lots of lacking in their nutritional part. So it is very important. Snacking should be there, but in a healthy way, and the time interval should be maintained, not before your major meals.
Okay. And we have also seen that nowadays schools are also taking initiative and they are making a proper diet chart, and they are giving to the parents that this day on Mondays this kind of food would be prepared and Tuesday these. So they have a proper diet. So they are also taking initiative. So on that note, what would you like to tell the school authorities out there also, and as well as the parents, that they should be because some parents find it, oh my God, Monday I have to give this, Tuesday I have to give this. So a proper diet chart is maintained. So what would you tell the parents?
In fact, in my case also, when my child was going for a kidsy, so at that time they were having a long routine. Early in the morning I have to get up and prepare the breakfast and all. But in one way, they those those schedules, they include all sort of like food items. If they are taking today roti sabji, then obviously they will give some other like some traditional food items, maybe malpua or some kind of pitha like things. Those are very important. Then they will not have like only one type of food items regularly having. If some
all kind of nutrients they'll get
actually they will get all sort of nutrients and variety. When variety will be there, obviously they will feel like eating. If you give same type of food every day, obviously they will feel bored and they will just pack the way you packed up the tiffin, they will return back.
As well.
And one thing I'll suggest, that always include at least one seasonal fruit in the when you pack the tiffin, because nowadays I have seen many parents they say that my children, they do not take fruit, they do not take vegetables, but if they are not taking, maybe there are some children who do not like to take in the form of fruits, but you can prepare some other forms, like you can put it in the form of sandwiches. You can put
it inside the chapati as well, and make it in an interesting fact so that they can have it properly.
Right, they can prepare some noodles with the chapati and add some nuts over there. They can prepare some salads with the nuts and with some veggies, and also some fruits can be incorporated with that. So inculcating some such kind of food habits in the children, then later part of their life they will also carry the same pattern of eating habit. So in thereby they will not have some diseases. They will come to know that having too much of fatty foods, having too much of like deep fried items may lead them to obesity. I have seen many children now coming up with the obesity problem. This is a very common in now children
issue which has come up, isn't it? And if suppose like if child is not well and he or she is ill, so that person might not be feeling to eat something, isn't it? So in that case, what can a parents make some mild kind of item in their tiffin and they can give it to their tiffin? What kind of proper diet in that mode of time? Because you have to have a proper diet as well when you are ill. So in that case, what a parent can make for interesting, or what a parent can make a bit of tasteful, and also the nutrients also they can get.
Yeah, they can prepare some tikkis, I'll tell you in a very interesting way. They can boil some chickpeas, and with that like some green green peas together, they boil it and then mash it. After that they can make some tikkis and put it inside the burger buns. So it will become a sort of like burger, but it will not carry those fried patties. So the patty will be prepared from the chickpeas and the only that green peas only. So and they can smear over there, like chickpea paste can be prepared with a bit of vegetable oil can be added over there, or some olive oil if it available at home. So those can be prepared at home, and after that like some sort of like pancake can be prepared. It's very easy. I give this idea to each and every parents because it is very easy.
Because whenever they come to you, they must be very confused like what I have to prepare. So Tina, whatever like suggestions you give, this kind of suggestions.
Right. So I tell them you put some oats and then banana. This is a very common recipe I tell to everybody, and a glass full of milk, because oats Oats will give you energy, and banana will give you this fiber part of thing, and milk will give the calcium. So these three will be combined together, make a pancake with that, and then pour some honey over there. It will become interesting for them also, and as a parents you will provide the sufficient nutrient to them.
Okay. So Tina, whenever a parent comes to you, you suggest her that you prepare in this mode and you prepare in this. What kind of interesting facts you tell them to go for this and that?
When I tell them you can prepare a sort of like, this kind of snacks at home only, they become, oh really? Their expression is somewhat like that. They never have thought about it.
Which is very easy and available at home as well.
Easy available at home, and always like you can chop some eggs and then toast with some pieces of cucumber, and after that, when you, as I told you, that chickpea paste, you put it in the bread, and after that you flip up those stuffing over there and you make a sandwich. So they said, oh really, it is it
it's
possible?
Easy and it's available actually.
So such kind of, and you can put some pudina paste also, because pudina is very much available nowadays, and pudina contains some acylic acid, one very useful kind of things present in the pudina that is help in healing and recurrence of the pimples. It prevents down. So usually the children are not like pudina, so if they make a paste with that, and then if they put it over the burger buns, and the sandwiches can be prepared with that, so obviously the it will help the parents.
It will help the parents, and the children will also like it. So Tina, on last note, what would you like to tell the parents, because we are short of time and we have to end this discussion right now? School-going children should provide proper breakfast, lunch and dinner. These three major meals are very important. You provide snacking to them, but snacking should be less of oil content, saturated fat mostly, should be less on it, and should be a healthy snacking. As I have given some ideas how you can prepare some homemade snacks. And if you are taking your children outside, you should make them to choose what is healthy and what is not healthy for them. At least you build up the habit of choosing the right food right from the school going age. Then only they will build up a healthy future. Right. So thank you, Tina, for coming to our show once again and giving us so valuable inputs on the entire episode about the children, of the school children, what should they carry in their diet, and also to the parents out there, you must have heard Tina saying that what kind of proper tiffin you can prepare for your children, because they are in the school, they will be having lots of physical activity. For that, they need to have a proper diet. And well, viewers, if you have any question, you could send through WhatsApp, and our WhatsApp number is flashing on the television screens, and the number is 7637075333. I'll repeat the number once again, 7637075333. So on that note, we'll have to take a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja. Well, viewers, your babies are your first priorities. But in the recent times, due to several reasons, serious diseases like child cancer has seen upheaval in the region. So today we will take you to Hayat Hospital, which has shown 100% success rate in treating not just general illnesses in children, but also treating deadly diseases like child cancer in them. Let's have a look at what the hospital has to offer.
Today we are at Excel Care Hospital, the hospital which is known for the best care of the pediatric department, which has been providing excellent services and dealing with the critical and emergency cases in the infant babies. Let's see what's up there.
Your babies are your first priorities. But in the recent times, due to several reasons, serious diseases like child cancer has been upheaval in the region. Excel Care Hospital in Guwahati is a hospital specialized in pediatric department. Since its commencement, the hospital is well equipped to look after every illness in your child.
Now we are at the ICU of the newborn babies at Excel Hospital, and we have with us Dr. Prakritish Bora, who is the head of the pediatrics department. We will directly go to the doctor. Doctor, how the treatment begins, like for the critical treatment of the newborn babies?
See, when a baby is born newly, then we have three different types of babies. One who will not require any treatment, active treatment, just a routine care. So the newborn unit that we have in the OT has the facility to look after the baby for a couple of hours. So normally a staff will be engaged there, and the baby will be attended by the doctors. If the baby is found to be fine, then normally he is shifted to the mother. We never bring the baby to here. So it is only for babies who will need some amount of treatment. Some amount of observation maybe. Then we have three different categories: level 1, level 2, level 3, depending on how serious or sick the baby is. So it is not only inborn babies we are looking after. This unit is pretty big. We have 14 beds, and that's a huge number of beds for a private setup like us. So what we do is, the OT is very near to us, just adjacent, so that the transfer is easy. If we have to transfer a baby, it's very easy. We have to get the baby through a transport incubator when required, or a trolley. So we get in from here. This is our reception. This reception will will indicate where the baby will get admitted, whether it is level 1, level 2. And from the reception, we enter. We have a single entry point. So we enter from this door here. And then always the concern about newborn babies is about infection, cleanliness. That is important. So the first thing that we have is a hand wash. So anybody getting into the NICU cannot enter unless they have washed hand properly to the elbow level. And so that is the reason we have kept the entry as single point. Yes, we are completely equipped even to manage certain cancers that the children will suffer from.
Not just the children, the hospital also has the first of its kind stay back chamber for their parents to stay with them, as for a child, a doctor can be the source of care, but parents can be their source of love and strength.
The ICU dormitory for the relatives. So this room we have bunker beds and well equipped bathroom here, which can be used by the ICU relatives, especially at night. And this area is normally empty during the day because it needs to be cleaned. So you have bunker beds on two sides. One side is meant for men, the other side is meant for women. So there is a segregation for both kinds of relatives, and they can use these beds at a very low cost. So it's a very minimal cost for the nights, so that the relatives and the parents can be comfortable here.
As the health of babies is a serious and very sensitive issue and can be hit by diseases just after the birth too, so Excel Care Hospital has different operation theatres for babies under the age of 6 months and for babies more than age of 6 months, known as NICO and PICO care for babies.
You said about some Nico Pico concept. Our viewers would like to know more about Nico Pico in the hospital.
See, the NICU is basically for newborns up to the age of 30 days, that is 1 month. So this is the area, if a baby is 30 days old or less, he will get treated here. So anything more than 30 days, we have the PICU by the side. They are getting transferred to those units.
Excel Care Hospital has shown an excellence in pediatrics by dealing with certain rare cases in babies.
Recently, we conducted a surgery on a 6-month-old baby, which was a very rare case. That baby is a thing called fetus in feto, wherein the baby was carrying another baby in his chest. So that baby was being treated as a case of pneumonia outside, and then he was referred to us because his pneumonia was not getting resolved. So then in the X-ray we saw that there was a bone-like thing in the pneumonia. So then we got suspicious, got a CT done, where it was confirmed that there was a baby inside his chest, and that baby was thriving because his umbilical cord, the cord that touches, that connects the baby with the mother, was connected to the diaphragm of the other baby. So that baby started to grow, and it almost grew to the size of 1.5 kilo. and that was compressing his lungs and the other lung also, resulting in severe respiratory distress. So, and our surgeons, the cardiac team and the pediatric surgeons, they removed the baby successfully, and that baby has been completely cured now, and that is one big case that we have done so far.
Fully equipped to deal with any kind of illness and emergencies in your child, Excel Care also promises the best care and speediest recovery.
This is the area, isolation area, that I was talking about. This is special in the sense that, again, there will be no cases going into the room, because we want the infections to be out. And this room has a aseptic area, aseptic hole area. At this point, unfortunately, we do not have a patient, and otherwise we could not have seen this area. This is the area which is called aseptic hole. This is any doctor, any staff, anybody coming in here will have to change into mask, gown, and even gloves before we go into the main patient area. So this is the aseptic hole area. Then as we come in here, we can see that this is the patient area, who will be completely isolated from the rest of the ICU. Okay. And the best part is we have air regulation. We have something called laminar flow, wherein depending on what kind of patient we have, it might be an immunocompromised patient like leukemia, or a patient with HIV. So what we do is we can either transfer the air to positive or negative.
So viewers, that was Excel Care Hospital, and we have found that the pediatric department of this hospital has been providing best of its care to the infants. It has dealt with the emergencies and critical cases in the infant babies, and along with the facility of Nico Pico and the other facilities, the hospital is very well equipped for treating the critical and the emergency cases in the babies. With camera person Rupak and Montu, Priti Pradarshini for Northeast Live.
Alright, with this we have come to the end of the show. We hope that we were able to answer all your queries in the best possible way. In our next episode, we will be discussing on some other important health issues. So if you have any queries, please do let us know by emailing us at goodlifeanylife@gmail.com. And you can also WhatsApp us, and our WhatsApp number is flashing on your television screen. Stay healthy, stay fit, and keep watching Northeast Live. Goodbye.